Today we're going over the top 5 things you can do to help prevent low back pain if you sit for work. My name is Rob Flanagan. I'm a chiropractor here to educate and empower you so you can own your health and do what you love. Today's advice is for those who are sitting all day for work and if you have a lot of hobbies where you're sitting for prolonged periods of time. Number 1, move more. This sounds obvious, but when you're caught up getting your work done, it's easy to spend hours in the chair before you realize you haven't got up and moved at all. Taking frequent breaks from sitting, just micro movement breaks, even just standing up to stretch for a minute or taking a short walk, those make a big difference over the course of an entire day. The key is to set a reminder for yourself. If you have a smartwatch, take advantage. Those can buzz you to remind you to move. If not, you can get an app on your phone. There's plenty available out there. You can even put them on your desktop computer to help remind you to take movement breaks. Ideally, you'd take a break every 30 minutes. If you're caught in a meeting or a phone call, you can do a little extra stretching afterwards if need be. Number 2, extension stretches for your low back. Doing standing back bends or press-ups, similar to cobra pose in yoga, are great ways to get extension movement into your lumbar spine. Modern life is very flexion-based. We're sitting, that's forward flexing. We're always bending, reaching, lifting things. Rarely are we moving backwards to balance out those movements and stressors. Your joints thrive on movement in all directions. Number 3, improve your workstation ergonomics. Most of us have seen a chart showing proper sitting position with your monitor at the right height, a separate keyboard and mouse, good office chair, the desk at the proper height for you. Those things do make a difference when you're sitting for 8+ hours a day. You can also look into a sit-stand desk. So you have the option to sit and stand. The more you're switching and changing positions, again, the more you move, the better you're doing. The other thing to keep in mind is putting items that you frequently are using within easy reach. Having something below your desk requires you to bend down, reach for it constantly, or just reaching far across the edge is going to make your back work more. Number 4, the big 3 core exercises. Spine researcher Stu McGill recommends 3 specific exercises help strengthen the core to improve stability in your low back. This is the side planks, curl-ups, and bird dogs. Side planks are a great option to hit your oblique ab muscles. You can do these from your knees as well, if that's an easier position to start with. Curl-ups are a great way to hit that front ab muscle, the rectus abdominis, the six-pack muscle, and it's easier on your back than doing crunches or sit-ups. And bird dogs are a great overall trunk stability exercise, incorporates using your arms and legs. Remember to keep the back still, move the arms and legs when you're doing those. Form is important with these. Focus on quality first and then improve the duration, number of reps, the difficulty as you go. Number 5, training your lumbar multifidi muscles. Not sure what those are? You're probably not alone. Your lumbar multifidi muscles are deep spinal muscles that stabilize your low back when you bend forward in particular, which is usually when people get hurt in their low back. These muscles are weak and sluggish in patients who have chronic low back pain. This is well documented in research, and they're great to work on, but hard to target. There's a good research study from Belgium that found that doing some low back exercises like leg extensions and 4-point kneeling, back extensions, or reverse hypers or bilateral leg lifts with a 5-second isometric contraction or a 5-second hold at the top of each rep actually increase the size of the multifidi muscles in those participants. The key was that 5-second hold at the top. Doing a regular repetition did not produce size increase in the multifidi muscles. Again, these are key for stabilizing your low back and highly relevant for chronic pain. A good rep scheme that they used in the research study was 3 sets of 15 repetitions. If that's too much initially, start off with a lower amount and build up to that as tolerated. Number 6, bonus time, is addressing your mental health. That's because pain is not just about what's happening in your body. The sensors in your body send input to your brain, but that alone doesn't create pain. Your thoughts, your feelings, your cognitive and emotional input is combined with the sensory data, and then your brain decides whether to sound the alarm or create pain. The same injury in one person in a good mental state is going to feel less pain than someone who's in a very bad place mentally. This is something that can be helped with different lifestyle factors, regular exercise, a good night's sleep, good diet, meaningful social interaction, other things like that. But you may need to work with a health professional to fully address this if you do have clinical depression, anxiety, problems like that. This is something that's often overlooked when you're experiencing a musculoskeletal problem, and back pain's no exception. In summary, we talked about 6 things. Number 1, moving more and setting reminders to do so. Number 2, stretching in extension or doing back bends. Number 3, improving your workstation ergonomics. This could include a sit-stand desk. Number 4, the big 3 core exercises: side planks, curl-ups, and bird dogs. Number 5, training your lumbar multifidi muscles. This can include back extensions, leg lifts, leg extensions from 4-point kneeling. Include a 5-second hold with each rep. That's key for increasing muscle size. And number 6, improving your mental health, because pain is a cognitive, emotional, and sensory experience. My call to action for you is to pick one of these areas where you could improve upon and focus on that for the next week and see how you feel.